I'm Shannon. I'm a level 1 nursing student. I think I have your patients already if I listen to an SBAR report.
Yeah, no problem. So you have Marta Yarn in room 529?
Yes, I do.
Okay, Marta Yarn is an 80-year-old female who has no known allergies. She is a full code. Her doctor is Stephen Jolly. She was diagnosed with a stage 3 non-healing ulcer that is 3 months old. She tried to treat it as an outpatient 6 months ago, and that didn't work, so that's why she's here. She was admitted from her physician's office. Her history consists of multiple admissions for dehydration and pneumonia. Neurological wise, she's alert and oriented ×3. She is cooperative. Her pain, she does have a sharp aching pain that has lasted for 3 months in her sacral area. That is a 6 out of 10. We have been treating it with acetaminophen. Her vision, she has 20/40 vision bilaterally. She is slightly hard of hearing. Cranial nerves are intact. She is up with a walker, and we need to stand by for assistance in case she needs assistance walking. She has a coordinated gait, but she is slow. She uses a walker. Respiratory-wise, she has had multiple admissions for pneumonia, so we need to be careful with that and observe her. She is a non-smoker. Her chest expansion is symmetrical. She is clear to auscultate in all fields. Anterior and posterior are diminished in the bases of her lungs. We'll keep an eye on that. O2 saturation is 92% on room air. We also need to keep an eye on that. Respirations are 24. Her heart sounds, cardiovascular-wise, she is good. She doesn't have any issues there. Her sinus rhythm is normal. Cap refill is less than 3 seconds. She's warm to touch, plus she has the expected pulses in all extremities. She has a regular apical pulse. GI-wise, her abdomen is soft, non-tender to palpate, non-distended, slightly obese, no masses. Bowel sounds are active in all 4 quadrants. Her stool is brown and firm. Diet is regular except for after tonight. She will be on an NPO diet after midnight because she's going to be having surgical debridement on her sacral wound. GU-wise, her last input was 850 mLs, and her last output was 350 mLs. Her urine is clear and amber in color. Her urinalysis was negative. She does have occasional stress incontinence and nocturia, but she does void by herself. And her last vitals were taken. We need to take them every 4 hours. Her last vitals were respirations 24, 99.1 temp, which we'll keep an eye on. It's probably due to the infection. Her heart rate was 88. Her O2 sats were 92% of room air, and blood pressure 144/90. She does have a peripheral IV site, and we are going to be administering normal saline with 20 mg of potassium, I believe. I'll have to check that order when we look at it. And she is supposed to get gentamicin IV piggyback, 80 milligrams per 100 mLs, because her labs came back positive for her culture. Her blood culture came back positive for E. coli, which is a gram-negative bacteria, and her white blood cell count was up 12,500, which it should be between 4 and 10. And we are going to keep an eye on her wounds. We're going to make sure that she has enough IV fluids so that she doesn't lose too much water via her wounds. And she is going to be NPO after midnight. And we're going to keep that dry, and we're going to keep her wounds dry and cleanse it with normal saline, cover with hydrocolloid dressing. So, yep.
I just have a couple of questions about the medication, if it's all right.
Yeah.
to ask. So why specifically is this client receiving this medication?
So this client does have a sacral wound that is a stage 3 ulcer, and it is infected with E. coli, which is a gram-negative rod-shaped bacteria. And this gentamicin is used to treat gram-negative bacteria infections, so it should help.
So what action does this medication have on the body?
So it inhibits the protein synthesis in the bacteria, so that it can lyse the bacteria and destroy it.
Okay, and when should you question administering this medication?
You want to question if this client has any hypersensitivity to medication or to aminoglycosides. If they have renal impairment, which she doesn't. She is slightly hearing impaired, but if they have a hearing impairment, it'd be contradicted. Any neuromuscular diseases as well.
And does this medication have a therapeutic serum level?
Yes, it is between 5 and 7 milligrams per kilogram per day.
And what vital signs should be monitored?
So we're going to monitor her temperature to make sure that's coming down after we give the medication. We did take a culture beforehand, which is necessary before giving any type of antibiotic. We're going to make sure that we check for ototoxicity since she is slightly hearing impaired. We're going to do all the vital signs. We're going to do check for nephrotoxicity as well. And that's pretty much all the vital signs
And which physiological parameters should be monitored when the medication is being administered?
So you're going to monitor her level of consciousness. We're going to do neuro checks. We're going to check for dizziness. If she has diarrhea or if she has vaginal itching, it might indicate that she has a yeast infection. We're going to check her hearing, make sure she doesn't have any ototoxicity because she's slightly hard of hearing. We're going to monitor white blood cell counts. They should be going down. And we're going to monitor for signs of any adverse reactions and any anaphylactic reaction to the medication.
And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So we're going to want to teach the client to be looking at her IV site because it could become infiltrated and therefore it could harm her. So any signs of swelling, redness, heat, infection at the IV site is a huge one, and we would want to have her call us so we could start a new IV line.
And what about the interventions that should be taught for taking this medication safely at home?
So she probably will not be taking this via IV at home. However, we would want to teach her the 5 rights, so we would want to teach her that it's the right medication, that it's for her, the right dose, the right time, and that the expiration date was good, and things like that. So, and then you'd also want to teach her signs and symptoms of when to call the doctor. That would be important.
And what are the side effects and potential adverse reactions?
So, ataxia, vertigo, ototoxicity, nephrotoxicity, hypomagnesemia, muscle paralysis, apnea, things like that.
And so how will you know this medication is effective?
So we're going to monitor her white blood cell count and make sure that's going down. We're going to do a new culture typically in 3 to 5 days and make sure that that the bacteria is gone, the E. coli.
That's all the questions I have right now. Can I watch you administer the medication?
Yeah, no problem. Okay, so I'm going to go into my sim chart, which I'll come over here so you can see how much is my MAR is going to be in here, which is in the Klein's chart. Okay, so she does have some gentamicin ordered for Tuesday at 1400, or sorry, Tuesday at 1600, correction. And it's to be administered IV piggyback every 8 hours. And the dose of the medication is 80 milligrams per 100 ml per 1 hour. So we're going to want to pull that medication out. And I'm going to look to make sure that it's clear, not cloudy, that there's no particles. The expiration date, July 2016, which is good. And I'm going to make sure that this is the right medication for Marta yarn and gentamicin, and it's going to be administered via IV piggyback every 8 hours at 1600, and it's going to infuse at 80 milligrams per 100 ml per 1 hour. So we'll set that aside for when we go in the room. And then I'm also going to look at the primary, which is going to be the normal saline. So it's sodium chloride, 0.9% with potassium chloride. So this is sodium chloride, 0.9% with potassium chloride, 20 mix, and 20 mix. And it's going to infuse at 125 mLs per hour, and it is to be given at 1600. And I'm going to check to make sure that there's no particles in it. It's clear, not cloudy. There's expiration date is January 2016, which is good. Okay, and we're going to go meet our patient now. Are you ready?
Ready.
Okay.
Come in.
Hello. Hi, Marta.
Hi.
I'm Brenda. I'm going to be your nurse tonight.
Okay, hi Brenda.
Hello. And then this is a student. I'm sorry.
It's okay.
This is a student. Her name is
Hi.
Shannon. She's
Hi,
going to be
Shannon.
following me. Is it okay?
Yeah, that's
With-
fine.
Okay. So you want to wash your hands when you come into the room first thing. And then you're going to identify your patient. Can you please tell me your name and date of birth?
Marta yarn, 125/1935.
And then do you have any allergies to
Nope.
this yarn?
Not that I know
Okay, so it matches our chart, so we know we have the right patient. And Marta, we're going to be giving you gentamicin, which is an antibiotic. Do you know what that medication is?
of. Nope.
Okay, it is an antibiotic. It's going to help with your wounds. It is infected. I don't know if you knew that. That you've had on your bottom for a while. So this is going to clear up that type of bacteria that's specifically in that wound, okay?
Okay.
So have you ever been given this medication before?
I don't think so.
Okay. Some things you might want to know is, I know that you're a little slightly hearing impaired, so if you notice any changes in your hearing, please let me know immediately. Also, your IV site, which I'm going to check in a minute, you're going to want to keep an eye on that. If you see any changes and you notice any redness, swelling, pain, things like that, you're going to want to call me, and you need to be notified immediately of that, okay?
Okay.
So we're going to want to check our primary medication again. Make sure we have the right one before we begin the patient and my patient. So it's clear, not cloudy. January 2016. There's no particles. We have sodium chloride 0.9% with potassium chloride 20 mg for 1,000 ml. And that's what we have in the chart. Sodium chloride 0.9% with potassium chloride 20 mg for 1,000 ml. And we're going to be giving it at 125 ml per hour. And we're going to be giving it at 1,600 right now. Okay? So we have the right medication. Miss Marta, can you please tell me your name and date of birth again?
Marta Yarn, 125/1935.
Okay, so I'm going to check what she told me. And that's correct. Marta Yarn, 125/1935. And then I'm going to make sure it shows up here, which it did. And I'm going to scan my medication. Okay. And that's good. The site is her right peripheral. Time 1,600. And you initial it. Okay. So I'm going to wash my hands again and put on some gloves so I can check her IV site before I hang this and prime the tubing and all that. Because it would not be good if we needed to start a new IV, which we could do if it was infiltrated. But we wouldn't want to hang everything first after we scanned it and all. Okay, you want to get an alcohol pad because we're going to need to scrub the hub. So I have an IV flush here. Miss Marta, can I just touch on here?
Yeah.
It doesn't feel hot, and then it's not red. Does it hurt at all?
Nope, feels fine.
You always want to lift up the patient's arm too, make sure that they don't have any fluid building up underneath here, which could also be a sign of infiltration. So I'm going to scrub this hub. You always want to make sure that you expel a little bit of it, the air bubble, or so it doesn't put too much pressure through the IV site. I'm just making sure that it's going through okay, that there's no blockage. And I'm going to leave this here to keep it sterile. Okay. So I have my documentation. I'm going to save it. And then we are going to scan the gentamicin. That we have as well. So can you please tell me your name and date of birth again?
Marta Yarn, 125/1935.
And you have any allergies, Miss Marta?
Nope.
Thank you. I'm sorry I've asked you so many times.
It's okay.
So you're going to scan that, and then you're going to scan the medication bag. So it's green, that means it's verified, just like the other. And we're going to document the same thing, the time it was administered. And my initials and the site.
Doing fantastic.
Do you have any questions for me?
What are some signs of reactions that I could have?
So as I said before, you could have some ototoxicity. I actually also have a pamphlet for you, so how about I give you that?
Okay.
And then if you have any questions, please let me know, okay?
Okay.
It has some different signs and symptoms, changes in hearing, confusion, dizzy, fever, loss of balance, muscle twitching, numbness, tingling, okay? So if you have any questions about that, please let me know while you're reading over it.
Thank you.
So, I'm sorry, I forgot to tell you, we need to spike the bag, because it's not spiked, okay? So the way you're going to do it, this is sterile, this end here and this end here, and then you're just going to stick it in without touching anything. You don't want to hit anything. And then you're going to want to hang it and prime it. And you're going to squeeze this twice to make sure the drip chamber is full, half full. Okay. So we're just going to follow the line like it's leaking. Right here. So you're going to unroll the clamp and prime the tubing. You can see the air bubbles coming through. And sometimes they do get stuck, so you need to help them. Otherwise, the machine will give you a hard time and say that there's air bubbles in the line, which happens often. And you don't want that. Okay. So it just slides right in. If you're lucky. Okay. So I am going to scrub Miss Marta's hub and connect this, just in case that it got anything on it again. patient. So, is this a new patient? Yes. Med search, Lord, yes. And then we're going to put her number in. That is on her ID band, 716.
2893.
2893. Okay, confirm. Then we are going to go on channel select. For viral IV fluids, 0.9% normal saline with 20 mg of the potassium. Was this correct? Yes. The rate is 125 mLs per hour. To be infused, however much is in the bag. We'll put a little bit less than that, so it'll let us know when it's run up. And then we'll start it and make sure that this drips. And we need to unroll our clamp as well. One, two, three, four, five. Okay, so it's going. And then we're going to do our secondary. So we'll take the primary, hang it lower. So that it'll infuse slower than the secondary. So we checked our medication, our gentamicin injection. We'll check it while we're hanging it. So you're going to prime the tubing the same way. You're not going to want to touch this with this, or touch anything because it's sterile. So you just spike it. I'm going to hang it, or hang it up. If I can reach, I'm so short. Okay, and then I would fill the chamber. Unroll my clamp and prime my tubing. It's primed, so we're going to get another alcohol swab because this also needs to be sterile. So we're going to put it in this first port here. Scrub the hub for 15 seconds. Connect it. And then we're going to do channel select. Secondary. Going to go to the medication, so G for gentamicin. Gentamicin. Q 8 hours. And then it's already on there, 80 milligrams per 100 mLs. 80 milligrams per 100 mLs with our chart. So I'll choose that one. Gentamicin 80 milligrams per 100 ml was selected. Is that correct? Yes. And then we are going to, it tells you the same thing, and it says to confirm, press next, so next, and start. Unroll your clamp, and make sure it drips. Okay. You're going to take your gloves off, wash your hands. And then you're also going to want to document your